child subluxation right there. Talking on the phone, that can be another one. Here's one for ladies who are carrying purses. Okay, purses can be a big problem, especially if they're overweight. But also along this line would be backpacks for kids. Okay, backpacks are way too heavy for kids. That's going to cause more pressure on the shoulders and on the neck. And then for men and women, carrying a laptop case or a briefcase, that stuff has a tendency to be pulling on your body as well. Okay, postural stress. This is a big one just because technology in general has taken over our lives. We have cell phones, we have computers, we have video games. There's a lot of different things going on here that can cause subluxation. Cell phones and video games for kids have kind of taken over the old, the playground, getting out in the backyard and actually playing. Kids just don't get the same physical activity that they used to. A lot of kids are stuck in school. Adults can be stuck in school as well. And then computers. Computers are pretty common these days. Does this posture look familiar to anyone? Yeah, you can probably see that either your family members working on a computer or when you're at work. The head weighs the same as a bowling ball. Who's heard that one before? Yeah, some of you have. We use that example here occasionally. So now, take a look at this picture again. Anytime your head is leaning forward from your body, so anytime you're like this, there's a lot more pressure on your neck. Okay? The neck is going to be one of the most common areas contributing to headaches. So anytime you have bad posture, you're making yourself more and more susceptible to headaches. Make sense? Okay. A couple research articles that we came across. Many patients labeled with a diagnosis of tension headaches may have headache originating from functional abnormalities of the cervical spine. Okay? So many patients with tension headaches have abnormalities in the neck. That's essentially what that's saying. Okay? This comes from a journal called Cephalgia. Anybody know what cephalgia means? It's headache. So there's a whole medical journal designated for headaches. Kind of interesting, I thought. But anyways, they're talking about abnormalities in the neck. Okay? So once again, if we have a computer scan of your neck, if we have an x-ray of your neck, we can figure out where the subluxations are, and then that's how we know where to do the adjustments. Here's another one from the Journal of the American Medical Association. Dysfunction in the neck muscles. Didn't somebody mention neck muscles back here? Dysfunction in the neck muscles contributes to headache pain and is the reason chiropractic deals so well with tension headaches. Right there it is. Okay. Thought that one was pretty good. Here's one for subluxation and migraines. We studied 127 migraine patients. 20% had 90% less migraines. 50% reported significant improvement, and it was only after only 2 months of care. Okay. So in other words, 7 out of 10 people at least had significant improvement within 2 months of chiropractic care. So now, what if you had 3 months of chiropractic care? What if you had 5 months of chiropractic care? Or even a year worth of chiropractic care? Do you think that 70% is going to go up? I know it will. Just from being in this office for many years and seeing hundreds of people come through here with headaches, yeah, we're going to be well over 90%. Okay, when we start to increase these numbers. That was from the Journal of Manipulative Physiological Therapeutics. Anyways, any questions on those research studies? Okay. So, once again, how do we figure out where the subluxations are? Okay. We do these computerized nerve and muscle scans. Okay. The thermal scan is going to pick up temperature differences on both sides of your spine. That's going to have an indication as to where the subluxation is at. The surface EMG that's the muscle scan that tells us where the tight muscles are at in your neck or in your back. That's going to be a further indication where the subluxation is. And then, of course, the x-rays. Okay? The x-rays are probably the probably the most definitive test because we can actually see the structure of your neck. Okay? The X-ray is my favorite test too, just because we can actually see what we're working on. Another tool we have here in the office is actually this one. This one's real nice because it's so portable. You can take it wherever you're going. And basically, it has two sensors, and we run it up your back and up the back of the neck. Okay? And the little needle on there, if there's a difference side to side, then the needle is going to bounce over to the side. Okay? So what we do is we run that up your back, and if that needle bounces off to the side, then we know that's a level of subluxation. So we do that all the way up your back, just like that. It's a pretty nice test. It's pretty simple to do. If anybody wants me to try that out on tonight, we can do that. That's a real easy one to figure out what's going on with the person's spine. Okay, chiropractors detect and correct subluxation. That's what we do. Okay, there really isn't an alternative for correcting subluxation. Okay, there's no medication that's going to work on it. Doing a massage is good, but the massage is not going to move those bones back into position either. Okay, it takes a chiropractic adjustment to fix that subluxation. You got to end with a happy slide, right? Life without headaches. I was thinking of, today when I was preparing for the talk, I was thinking of one of the patients who came through our office. This was probably 4 years ago by now. No, it's maybe been 5 years ago now. And actually what happened is, it was a little girl was a patient. She was 9, I believe, when she started coming here. But her grandmother calls up one day, and I happened to take the phone call, and her grandma was asking all these questions about headaches and stuff like that. She was describing what was going on with her granddaughter. She said her granddaughter was on one of those merry-go-rounds at the park, and she tried to jump off the merry-go-round, but it came around and hit her in the back of the head. So like right at the base of the skull is where it impacted her. And what happened is this girl developed headaches, like almost instantly. Okay? And it went on for about 1.5 years. Okay? And they did literally everything. The parents took the little girl down to Mayo Clinic in Rochester. They'd gone down there like 4 or 5 times. She was on so many different medications that she was throwing up at least once a day from all these different pills that she was taking. And the grandmother was telling me this whole story, and I'm just, we need to see this girl. Okay? Just by the way the grandmother described the injury, I knew it was going to be a neck problem. Getting hit in the back of the neck, the back of the head, the neck was going to be off. And the mom brought the little girl in. She was only 9, but she was willing to try anything because she was tired of throwing up every day from taking these medications, and she was tired of having headaches as well. That's just another example. In this case, the medications weren't even taking care of the headaches, so it's kind of like a double whammy. But anyways, brought the little girl in. We did the computer scans and the X-rays that we were showing you guys, and her atlas was off. The top bone in the neck was off by quite a bit. Okay, and we started adjusting her. And we adjusted her in the beginning. We adjusted her 3 times a week. As she improved, she got adjusted twice a week. As she got even better, we adjusted her 1 time a week. Okay. Now she's, for the last 4 years or whatever, she's been on a wellness schedule. She comes in every other week or weekly to get a wellness adjustment. She's doing really well. But along the way, when we first started adjusting her, her mom was keeping track of her headaches. She had like a headache diary for her daughter. And so I think 2 weeks went by, and I didn't say anything. I could tell that her neck was adjusting easier, and I figured she was getting better, but I didn't really say anything or ask too much. And then that 3rd week, the mom told me, you know what? Our daughter only had 4 headaches last week. And I was thinking, 4 headaches? Well, that's pretty bad. But they were really excited because she had been having headaches every day. Okay, so now she was down to 4. So I guess it's all perspective, right? If you're at 7 and now you're at 4, that's pretty good. I wanted her to be at 0, and so I was thinking 4 was bad. But anyways, so every couple of weeks, her mom would give me the update. You know, so it went from 4 down to 2 to 1, and then to 0. Now she gets 1 or 2 headaches a year. difference for that little girl. So that was one of our